Kollam has reported a worrying rise in snakebite fatalities, with the death toll reaching 7 following multiple incidents across the state. On Sunday, 2 women lost their lives due to snake bites in Kannur and Idukki districts. In the first incident, 65-year-old Nafeesa, a resident of Mutkuda near Taliparamba in Kannur, was found unconscious at her home. Police said she was rushed to the hospital. Later, it was confirmed that she had been bitten by a snake. She was treated with anti-venom and placed on a ventilator but died early on Sunday. Doctors suspect she may have been bitten by a common krait, a species found in significant numbers in the area. In another incident, the same day, 75-year-old Vishalakshi died after being bitten by a snake near her house at Kannur in Idukki districts. Police said she was working outside when the incident occurred. Although she was immediately taken to hospital, she could not be saved. Meanwhile, several other snakebite cases have also been reported across the state. A tourist from Coimbatore, identified as Sharmila, was bitten by a snake in the garden of a resort at Chirai near Kochi and is currently undergoing treatment at a nearby hospital. In Kollam district's Raman Kulungara, a youth was admitted to a private hospital after being bitten by a snake. In another case from Pathanamthitta, a person was hospitalized after being bitten at his home in Murani near Malapalli. Separately, the Chief Minister's office has announced that the government will bear the treatment expenses of 10-year-old Anush from Kodali in Thrissur district, who is currently recovering from a snakebite incident last week. His younger brother, 8-year-old Alju, had tragically died due to a snake bite a few days earlier. With multiple cases being reported across districts, authorities continue to monitor the situation closely. As snakebite incidents continue to rise across Keralam, how prepared are local health systems and communities to prevent such avoidable losses in the future? Stay tuned to Daily Salar Digital.